Get ready to listen, learn, and earn CE hours. This podcast features content from an accredited CE activity provided by Calibri Healthcare. Visit elitelearning.com/podcasts for accreditation and disclosure statements and instructions on how you may be able to earn CE credits.
For too long, nurses have been buried under just mountains of paperwork, endless documentation, and administrative tasks that really pull us away from the bedside. Do you know the average nurse spends nearly half their shift on administrative work? And that's time that we could be spending holding a patient's hand, we could be educating families, and being with our patients to help us catch those early warning signs of complications. But what if we could change that? What if artificial intelligence could handle the routine documentation, maybe automate the scheduling headaches, and really help us in flagging important patterns in patient data, all while letting nurses focus on that irreplaceable human element of care, the kind of care that really made us choose this profession in the first place? Hello, I am Dr. Candace Pierce with Elite Learning by Calibri Healthcare, and you are listening to our Elite Learning podcast, where we share the most up-to-date education for healthcare professionals. Thank you for joining us for our series called Embracing AI in Healthcare, Enabling Nurses to be Nurses. And our goal through this series is to help empower you with the knowledge and tools needed to help embrace AI and really enhance your practice. Joining me for this discussion is Dr. James Lamastro. James, welcome.
Thank you.
Yes. Thank you so much for joining us for this discussion. And I wanted to start with, can you tell us a little bit about yourself and how you got involved with AI?
Well, I've been in healthcare almost 30 years. I spent a significant amount of time in hospital administration, and primarily, I got involved very early in my career when I was at the BU School of Medicine. I was doing some research, and we had our own computer, and that was in the early days. So it was an old PDP 1145, but I got to do interactive data processing. So right from the beginning, I was on a computer. I was typing at a screen and doing that type of thing. So progressively through my career, because I've had that early experience, I've always been the administrator, the senior manager who they went to and said, we need to implement AI. We need to implement data processing systems in our thing. Let's, you know a lot about it. You've done interactive data processing. Let's go. In addition, I've owned a Mac computer, personal computer, for about 40 years. I have one of the original Macs sitting on one of
my goodness.
Oh, yeah. Sitting back there and stuff like that. So I've always been kind of a hobby of personal computing. I remember being interviewed some years ago as one of the few CEOs that actually worked on a personal computer and did his own typing.
Oh, really? So before computers became popular, you had one.
I had one. As a matter of fact, the only benefit I asked when I went to work at Mercy Hospital in Springfield was a personal computer. I think Sister thought I was going to ask her for a car. She was very relieved I asked her for a computer. But
nice.
So I've been really, really involved in this whole process. Very interested in it, and learned as we got and learned a lot just by using it. And in recent years, I've had a lot more time to spend investigating artificial intelligence and the way in which it's going to radically transform a lot of what we do. One of the advantages we really have is everyone knows how to use these personal devices. So these are not foreign instruments. Most nurses have a phone, a tablet, and stuff like that. So it's a lot easier transferring that type of skill to their workplace.
Right. Absolutely. Can you start with really helping us understand what is artificial intelligence and how is it currently being used in healthcare?
Well, artificial intelligence is just a simulation of human intelligence. It does many of the tasks human intelligence does by use of algorithms, which are just formulas that they use. Machine learning, which is a little more complicated. That's, writing code for machines and stuff like that.
Mm-hmm.
And natural language processing. Those are the three ways in which it works. But the focus of AI is on data collection, analysis, and rapid performance of tasks. And that's what it's really good for. And that's where it excels. And it's used extensively in healthcare right now. You may not even know it's being used. It's used in diagnostic applications, data analysis, electronic medical records. There are some radiological systems that employ it. Personalized healthcare, predictive analysis, used in pharmacies in order to see what drug interactions there are. And of course, a lot of it is used in administrative and operational efficiency to cut down on tasks and do various things like that. They've even artificial intelligence is being. I saw a rollout of we've had sitters, but actual robot that incorporates artificial intelligence to allow as a personal assistant. It's not going to replace a person, but it's there to do a lot of tasks that might be done by people.
So, looking at artificial intelligence, how are we going to see AI technologies really supporting nursing in the workforce as far as their daily tasks and those decision-making processes that they have to do?
Well, the thing it's going to do is reduce a lot of the administrative burden. A lot of times, a lot of effort is spent getting information into computers, into the electronic medical record. For example, from the various devices that are used, whether it's a pump or a blood pressure gauge and stuff like that. All those devices are going to be connected, so that when the nurse does the actual, taking the blood pressure or checking or loading the pumps or anything, all that stuff's going to be uploaded. So she doesn't have to write it down. She doesn't have to be bothered with the fact that they're recording it and stuff like that. So simple things like that may do that. In addition, I've seen some applications where the nurse carries around a personal device. It's basically a modified cell phone, in which they can actually dictate their notes and dictate some of the patient's requests, and all that information goes in as text into the system. And then at a later time, she might be able to retrieve it. Or AI can do things looking for words or expressions or stuff like that in order to alert the nurse to there's something's going on here that you might not be completely aware of and stuff like that. It just takes a lot of the time-consuming things that a nurse does and allows them more time to spend with the patient. At the same time, it may be recording a significant amount of information that normally may be missed because people just don't have time and the attention to do it.
Right. When you have so many patients that you're looking after and you have so much information. And I love where you were talking about how these systems can feed into other systems, because in a lot of the places where I have worked, you already have that happening. So I think we're not really realizing, hey, this is playing a piece of artificial intelligence. We're already seeing what artificial intelligence can do without realizing. We see that as, oh, that's so helpful. I can just feed that over, choose what I want to come over into the charting, into the documentation system. But we didn't really put that with, oh, that's artificial intelligence helping me pull that over. But I also loved where you were talking about being able to have a personal device where you record something. I think that would be so helpful, because you walk into that patient's room and you notice these things and you pull a napkin and you start, I don't know if you're writing on a napkin or you have a piece of paper in your pocket and you're writing on that piece of paper until you can actually get back to a computer so that you remember what you need to document, where I could pull that out and I could record it. And I assume you're saying like AI could pull that, and then I could go in later and make just changes to it, or, grammatical changes, or, maybe I said something that was subjective and not objective, and I need to take that out. But having it there as a starting point rather than trying to keep up with that piece of paper or keep up with that napkin.
And and those devices have multiple uses. I've even seen them incorporating buttons on those devices, so that if a person needs help, they don't have to call out in the hall and stuff like that. And so those devices are very useful, and they're in use. I think the Veterans Administration is a pioneer some of these. In addition, what they put on those devices is kind of interesting. They'll also put on query systems. So if the nurse is not sure how to operate the pump, or the pump is, maybe they changed the pump from the first time to the second time, she could take a picture of the pump and that will give her instruction. They'll download instructions as to how to use the pump or how to use the pump, how to connect it, and stuff like that. So there are a lot of, so she doesn't have to leave the room or call somebody else to do it and stuff like that. I think a lot of the personal devices um, may help minimize the amount of um, requests. For example, when you're not sure of something and you want to check it out, and then you might want to go into the nurse's station. You could still be at the bedside and still check it out, and you're not disturbing somebody else who's also doing it, trying to get their work done as well. Not so much
Right.
disturbing, asking them and stuff like that. And a lot of things is if you're involved in a team, a lot of those notes can be uploaded to a team note, and the AI can go through the team note and see whether or not, for example, maybe I need to alert this other person about this particular condition, and maybe I need to know that, or maybe I need to call the therapist in because they're not walking correctly and stuff like that. And also, I know that sometimes in a lot of times in large facilities, you have a lot of expertise, but you don't have. It's difficult to get access. I had one facility where I had, I think we were about 25 or 30 um, rehab nurses and another 100 therapists, the inpatient, outpatient. All of them had special expertise. We had loaded all that information into a blue book. I could imagine if I could have taken that information and put it into a program and file, so that if a nurse needed another nurse who had special expertise, she could just call that expertise up on that file and say, I'm running into this urinary problem. I'm not really sure what to do about it. Can you give me some instructions or help and stuff like that? Or can you better come and take a look at the person and do it and stuff like that? So that whole referral process can be automated as well.
Right. What about referrals? Since you're bringing up referral process within your facility, but also referral process within insurance?
Oh, yeah, they have some really interesting applications that actually connect the practitioners right directly to case managers and insurance, especially if they need approval and stuff like that. Some people are using, I've seen the application of Teams and some of the AI things in which the insurance person or the approval person actually has a channel that they can connect to. It's all privacy, it's all secure. So that they need approval for a certain procedure or something else like that, they can just get on that channel and get approval or not approval, especially on prior authorizations. It makes the prior authorizations a lot quicker. You're not waiting for
Right.
paperwork to go through and stuff. And the other issue is it alerts the person the authorization has been approved. Same thing with an order. If you put an order to a physician, a request for an order to a physician, the physician transfers the order to you. It could all be done electronically, and it can alert the person that the order has been transferred.
Oh, there's a lot of things that can definitely help with our time management and open up more time for actual hands-on patient care. How does AI improve patient outcomes and safety in healthcare settings? I know we're seeing how it helps with our time management and giving us a little bit of time back to really care for our patients, but how does it improve patient outcomes and safety?
Well, in terms of outcome, the more time the nurse has to spend with the patient, the more the greater the patient experience. So if you could eliminate tasks that the nurse does, so she could spend more time in direct contact with the patient, that's going to improve the outcome. One area in which you can improve outcomes is the whole issue of medication management, in which there are a lot of interactions and various things like that. We know that a lot of medication errors that occur are really systemic issues, and AI could help address those systemic issues by alerting the nurse to the possibility, hey, this doesn't make sense. This whole thing doesn't make sense. It's this medication that is not usually allowed for this particular. Maybe, and it may just be the case, and he or she could check it out. But that's the case, and it makes the whole transfer of data a lot more efficient, so that they're not errors which happen because someone writes something down incorrectly or passes a note incorrectly, because there's a direct transfer of information. It's a lot more accurate. Plus, it could check the accuracy of what you're doing and stuff. Did you really mean that when you put that
Right.
in and stuff like that? It give you feedback on that and stuff like that, and that can eliminate a lot of time spent, in recovery time. I took the wrong order, it wasn't correct, I did this and did that and stuff like that. So I think that's where it can help significantly.
Right. What are some common misconceptions about artificial intelligence and its use in healthcare?
Well, the first misconception is going to replace the nurse. Let's get rid of that one.
Right.
Yeah, it's not going to replace the nurse. There's no way it's going to replace the nurse. There's no way. It's one of the healthcare is probably one of the few areas that you just can't use robotics or anything else like that. There has to be somebody there who makes the judgment. One area that concern is the fact, one misconception is that it's going to de-skill the nurse. In other words, nurses not going to have the same skills that they had before because
Yeah.
artificial intelligence is not going to do that. If anything, and it's worked right, it's going to reskill the nurse. It's going to give her additional skills that she may not have had and concentrate on the skills that she's really good at, rather than at the administrative tasks that take a lot of time and paperwork and stuff like that.
Mhm.
It's not infallible. That's a misconception. Let's not take it. It can make mistakes, and that's why you need your judgment. You're still going to need good nurses who are competent, who are assessed for their competency and stuff like that, to be able to assess, is it giving me the right information? I mean, we have that whole issue we've all, I probably encounter it daily, of AI hallucinations where they give you a source, and you're looking at the source and say, "Oh, that's interesting source. I didn't know about that." You check it out. There's no source. They made the whole thing up. So you got to be careful that things aren't made up. You look
Yes.
at you go to Google Scholar and say, "I want to see the study," and the name's right, but the study's not, and stuff like
Right.
that. But I mean, it's getting better. When I first, about a year ago, it was really bad, and you had to check almost everything. And you still check everything. You had to go back and I think let me just ask it again. And it's getting very good at correcting itself. And don't be afraid of correcting the if you're using an AI system such as Chat or Claude or Gemini or anything else. I'm telling you, it's wrong. I don't think this is right, and it'll recheck its work, and they'll come back to you and they'll say, yes, I was wrong, or it does. AI systems don't think like people. I mean, we see, because we're sentient, because we feel, we have emotions and everything, and we see a lot more things. It means something. The nurse looks at the person and says, something's wrong with that person, just not right. And artificial intelligence is not going to pick that up.
Mhm.
I mean, they just know that something's wrong because they've seen it before, and it's in the back of their mind, and they're feeling it, and they express it, and it comes out that something's wrong. You
So
can't
AI
operate it
is
without human, without.
strictly off of the AI is strictly off of what we put into it. So it works off of what we put into it. Therefore, it is fallible because of the data that is put in or taken in is not necessarily correct.
But the problem might be is because the AI system is connected to other data systems, it might incorporate other
Mm-hmm.
data. So you've got to be careful of that. It might not be you putting the information in incorrectly. It may be the system is pulling information from other sources and stuff like that, and that's what you really have to, or other sources, and that's what you have to do.
Okay.
Um, it doesn't replace clinical judgment, and the implementation of that is not effortless. It's not just like pressing a button. You have to really work at it. You have to
Mm-hmm.
learn how to use. It's like every skill. You have to learn how to use the system. And some people are better than others, just like some people are better giving injections than others. Some people are better IVs than others and stuff like that. And that's the same thing with AI. Some people are better than others. And if you get a particular person on your team that's really good at it, then they can become a mentor for the other people. Just the same way you use, when
Right.
I know when the nurse has a problem getting an IV and she might call somebody else who says, really good at finding the vein and putting it in and stuff like that. Same thing with
Mm-hmm.
AI. I'm not getting anything out of this. I don't know how to use it, or I can't get what I'm looking for. So let me ask somebody else.
Right. And we do know bias is such a word that is used a lot today as far as cultural competence and in the way we think. And AI, we know it's going to be more objective because it's not going to have that subjective information being put into it, or it shouldn't, like what I would think is subjective as far as what I wouldn't document. So it's going to have more objective information in it, but it's not, it could still have bias, correct, in the information it gives
Well,
me.
because the bias get built into the algorithms, and that's where the real problem is. If someone's building the algorithm, they may unconsciously put a bias, whether it's gender, racial, ethnic, or their own pet theories about how things
Mhm.
should be. So, depending upon how the algorithm is built. So, if people start seeing results that aren't they're not consistent with their own judgment and things like that, then you can start looking at and seeing whether or not the algorithm is actually biased and whether or not someone should be looking at the algorithm to ensure that bias isn't built into the algorithm. I mean, there's a whole literature on racial bias in algorithms, and it's just
Mhm.
like anything else. Same thing. It you know, it's the way the system's trained. It's the way the algorithm is built, and it's not completely objective. It's what is put in there, and biases can sneak in. And the only way that they're found out is somebody gives us feedback. It's a whole
Mhm.
feedback loop. It doesn't get better unless someone says, "I have a problem with this. This thing isn't working the way I think it should be working," or I didn't get. I just don't. This result is just not correct. It's just not right. What's going on? I've done everything it's in. I've looked at it and stuff like that. So I need to move back and say maybe I need to talk to the people who design the algorithm to make sure the algorithm is correct. Maybe it needs to put more variables into it, and maybe it needs to capture more of what we're looking at. And that's an important thing that nurses can provide because they're the hands-on people. They're seeing what the results are. They need to continually feedback and not be shrinking violets about the fact that this is not what I want. I'm not getting what
Mhm.
I need. What I'm getting here is I'm getting a lot of garbage, and yeah, it's helpful in this area, it's helpful in that area. It might be helpful in managing a diabetic person, but it's striking out as far as cardiac people. So what's going on here? You know what I mean? And
Mhm.
what's going on? Provide that feedback so that other people could look at that and see whether the system people, the IT people could look at it and see whether or not what's incorporated into the algorithm, and they can ferret that out. They can look at the algorithm and they can see what variables it's pulling down into and how it's weighting them and stuff like that. And it
Mhm.
just might be the case of not that they have the wrong variables, but it's how they weight the variables
Mhm.
in the
Now,
algorithm and stuff
looking
like that.
at the information that we put into an artificial intelligence system, is there a threat of privacy risks in adding that information to the systems?
There's always privacy risks. I mean,
Mhm.
anytime you have an access point to a computer, there is a privacy risk. I I actually surveyed a hospital in California that had been hacked, and they've been hacked at a remote location by by someone who was a part-time physician's assistant who got into the computer, wasn't careful, and opened the whole system up
Oh,
to
goodness.
hacking so what needs to be done is that you need to put privacy things in, and the way in which you do that is you through training. You train people into these privacy concerns. You have to be careful what you put in and how you put it in and who has access to it. And it goes down to even simple devices. Make sure you lock your device, it's password encrypted and everything else like that.
Mhm.
Just as for example, um, you when you leave your cart, you lock your cart. When you leave the computer, you lock the computer so no one else can get in and no one's watching you do it. And you change passwords frequently, which I know is really a pain. But all those things can allay privacy concerns.
Mhm. So there's a lot of myths that you were kind of, some common misconceptions you were kind of talking about there with the use of artificial intelligence, especially within the human oversight where we're the ones who are putting that information in. And so we need to make sure the information that and the places it's pulling information from is actually giving it correct information. We have to remember those ethical practices of how to keep our patients' privacy and their sensitive data where it needs to be so that it can't be taken. And we also have to understand the capabilities and the limitations that artificial intelligence brings. And one of those limitations you just mentioned earlier was hallucination. So I wanted to circle back to that and see if you could kind of tell us what are these hallucinations and how can they impact their use in healthcare, and how can we minimize the effects of hallucinations?
Well, what I mentioned to these is it's common even outside healthcare is giving you the wrong source, giving you the wrong source to which you're going to go to and you're going to operate under and stuff like that, giving you a wrong set of instructions. For example, you go in there and say, okay, here's the case. What do I do? And it gives you it makes up instructions which are completely, it makes them up because it may not know what instead of telling you, I don't know, I don't have information on that. It kind of wants to help you. So it builds in it kind of hallucinates, builds its little dream world and stuff like that. And it says, oh, here's the answer to you and stuff like that. So you really got to check out the hallucinations and stuff like that and check
How do
out
you
and make sure
determine that it's a hallucination? How do I look at something and determine?
You have to be grounded. You have to know your field you're dealing with. You can't just, you have to be good at what you do. You have to be a good nurse. You have to be a good practitioner. You have to have knowledge and competency in that particular area. That's how you determine it. Because otherwise, if you're not grounded in the particular area you're in, it can give you false information. You won't know it. So, for example, if I'm working on a project and I have a lot of knowledge of that particular area, I'm working on personal brain injury, and I have a lot of knowledge of brain injury, and it gives me the information about brain. I'm saying that's not really the case. That's not the case. Let me check it out. Let me see whether or not this is really what I'm supposed to be doing, or the course I'm supposed to be following, or the treatment that's really prescribed for them, or the type of behaviors that I should be expected for someone like that that has that particular condition.
So there has to be continual oversight of a nurse, a physician, a therapist, whoever it is that is using this. There has to be that continual oversight where we go back and review it. We should not be saying that artificial intelligence, whatever it gives us, is the final decision. Would that be a good way of putting it?
Yes, it's a tool, and you don't. It's a tool that you use, so you don't make your final decision based on it. You don't use the tool as the final decision. Use the tool in order to help you make the final decision, and make a judgment call.
Right. And that really helps, I think, with reducing that administrative burden too, where we're trying to do all that research to try to find a diagnosis or to try to find the trends. So is just an example as we go into the next question, which is how can AI help with reducing that administrative burden on nurses? And I think that was a really great example.
Well, the administrative burden comes mainly from paperwork and the paperwork that they do and transfer information and stuff like that. What AI can do is it can make the transfer of that information a lot less less burdensome because it can analyze data in a way that quickly and in some cases more effectively because it's all tasks to analyze the data. But it has to, it also says that you have to put on other digital platforms as well. Like, for example, there's no reason someone can't just dictate a lot of that information in and why they have to write it down or type it in or anything else like that. And by doing that, we have natural processing language systems now that are fairly accurate in terms of dictation, and so that information can get in, and so that they don't have to type it out or write it out and stuff like that. They can dictate a lot quicker than they can type it. Right, and again, they can dictate anywhere using a small device, and that information gets into it, and that relieves the burden. And also in terms of transfer of orders and procedures and treatments and everything else like that, that can all be done electronically.
Great. There's some really great examples that you've given us as far as how we can use AI. And, a lot of people think of AI as just like, the different platforms you were talking about where we type something in, but we're actually already using some artificial intelligence tools. And I didn't think of them as artificial intelligence till you started talking about them, but just kind of ways that we are already easing into trying to relieve some of that burden that keeps us away from our patients. But we are at the end of our time for episode 1. Thank you, James, so much for joining me for this series. It's just a pleasure to hear you talk about this and to see the future direction of where we're going in healthcare. And to our listeners, thank you for tuning into episode 1. And I hope you'll join us for episode 2, where James will be back to help discuss some practical strategies for how we can look at integrating more AI into our workflows.
This podcast featured content from an accredited CE activity provided by Calibri Healthcare. Visit elitelearning.com/podcasts for accreditation and disclosure statements and instructions on how you may be able to earn CE credits. Take your learning to the next level by subscribing to more podcasts on compelling healthcare topics.
Thank you.